non-leaking bug.
Well, we want to all. I want to first thank the scientific committee for letting us present our results. I want to thank also two of my mentors here in this room, Dr. Kotler and Dr. Furcada. Thank you all. It's about depressive syndrome prevalence in hypertensive patients and its association with high pulse pressure and non-living power. Systemic hypertension affects about 2 billion people around the world. And depression is present in up to 10 to 30% of all hypertensive patients. So depression may affect about 600 million people with hypertension. In spite of being considered as a cardiovascular risk factor by the American Heart Association, and the major impact of this association with hypertension with depression, there's not yet a recommendation for a systematic screening evaluation of depression. A very simple scale, the CSD, Center for Epidemiological Studies Depression Scale, has been used to identify depression in several recent mega-trials as Mr. Pitt and Women Health Initiative studies. This consists in 20 points about the feelings of the patient in the past week. With 16 points, we have a diagnostic of depression, but in Mr. Pitt, for example, and Women Health Initiative study, the fourth and the fifth quintiles were took as moderate to severe depression. And they had a 2.5-fold increase in fatal stroke risk among those patients with hypertension. The aims of this study was to identify depression prevalence in essential hypertensive patients and to evaluate pulse pressure and non-living pattern in affected individuals as variables associated with high cardiovascular risk, especially for stroke. We took 144 patients that were included and 16 patients were excluded due to several causes. Our final population were 83 patients with hypertension assisted at the hypertension center and a group of 45 control patients without hypertension. Both groups consented to complete the CSD with previous signing of the respective information form. Results, as in Mr. Pitt, were expressed as quintiles, and fourth and fifth quintiles were considered as diagnostic for depression. In our population, depression was identified in about 76% of the hypertensive group, without difference in age or gender between hypertensive patients with or without depression. This is our population of hypertensive patients with mild hypertension and the younger population with half of them females. This is our prevalence, 76%, much more than previous series told. These are our results. Prevalence of non-living pattern and the pulse pressure was quite high in the hypertensive patient without depression, with depression, versus in green patients with hypertension and without depression. This was statistically significant difference by two different tests. 91% of those patients with hypertension had non-living pattern, and pulse pressure was 60 millimeters of mercury against 44 millimeters of mercury in patients without depression. So our conclusions are that depression showed a highly elevated prevalence in patients with hypertension and non-living prevalence. An elevated pulse pressure seems to be higher in depressive hypertensive patients compared with those without depression. This data suggests that statistical non-diagnosed moderate to severe depressive syndrome may be underestimated in general practice. Pulse pressure elevation and non-living pattern could be the underlying mechanisms or two of the underlying mechanisms related with increased cardiovascular risk in this population. CSD also proved to be a simple tool for depression screening. More studies are needed to analyze its association with a higher risk of stroke found in those large conventional trials.
Any questions?
Patient with high pulse pressure.
I can hear you.
In patient with high pulse pressure, you can have cerebral changes. Did you perform any study, imagine study of the brain in your patient to see if there were changes in the white matter?
I'm sorry, we have not images about
The brain.
in this
Because
case.
it would be some relation between the structural brain changes.
I can hear you, sorry.
It could be some relationship between the structural brain changes and the depression that you find in your patient.
Well, we think about the bimatter relations may be related to pulse pressure.
Pulse pressure.
Maybe. We don't know.
Another question? Thank you, Dr. Obregon.